A good day to all. My name is FARASHAKIRA NAJIAH, and I'm a Master in Biomedicine student from Management and Science University, Shah Alam. Today, I'll be sharing with you about my research project that I've been working on. It's about exploring the anti-diabetic and antioxidant effects of Centella asiatica towards Streptozotocin-Nicotinamide induced male rats on their liver. My project will start off with the introduction, some literature reviews, the methods I use, results and discussion, and lastly, the conclusion. A little background on diabetes mellitus, or DM. It is actually a chronic hyperglycemia involving the destruction or inhibition of the pancreatic beta cells. DM are depending on its insulin productivity and is classified into type 1 and type 2. DM causes degeneration of free radicals and ROS that leads to the oxidative stress. And interestingly, DM is closely related to hepatic damage. A previous study by Akhtar has shown that DM has shown increasing prevalence throughout Malaysia since the year 1995. According to his statistics, DM would be conquering with over 30% of Malaysians over the age of 18, that is about 7 million people in total. As mentioned previously, oxidative stress involved in DM is by the occurrence of cell apoptosis in the body, hence multiple organ malfunctions. It is crucial to understand that insulin plays a vital role in regulating the glucose uptake. Pancreatic damage will ultimately invite the intervention of either exogenous insulin or relevant therapy and stricter lifestyle. Hepatic injury can certainly progress in diabetic condition. A lot of complication can arise when DM leaves untreated, for example, NAFLD, which is the non-alcoholic fatty liver disease. If there isn't any amelioration, the organ may malfunction and leads to more severe cases like fibrosis, cirrhosis, or even atherosclerosis. According to a previous study by Loria in 2018, this is called the vicious cycle. Moving on to the in vitro studies, Centella asiatica is one of the most common medicinal herbs throughout Asia. It is locally known as daun pegaga. This plant was actually discovered with 4 main terpenoids contents, which are all beneficial to many properties. The problem statement involved in this study is first, the target pattern of DM. Second is the potential of CA in giving benefits to the disease, and how we contrast them with the use of the current anti-diabetic drugs. The idea is to investigate the overall effects of Centella asiatica for anti-diabetic, antioxidant properties, and functionality towards the liver in diabetic-induced rat models. And under the specifics, I have included certain related parameters in regards to the comparison for the analysis. According to recent studies, DM complication can be ameliorated by the intervention of CA extract. The bioactive compound was said to have anti-hyperglycemic activity, that is, could enhance insulin secretion in the body by improving the pancreas and reduce hepatic injury. Even so, the aid of standard anti-diabetic drugs are primarily used to minimize the complication of DM, though the cons and overconsumption effects are inevitable. Here is actually the overall in vitro studies design, starting from the plant collection and identification. From here, the properties and bioactive compounds were aligned with the effects towards primarily the pancreas and the liver. And this is the overall in vivo study design. I have used 40 Sprague-Dawley strain rats and classified them into 5 respective groupings, and the timeline throughout the project is as such. First is the analysis of the FBG. In diabetic, FBG is the most vital indicator for assessment. We could detect overdosage or any effects of the drugs that could lead to mortality. So in the diabetic group, it leads in having the highest FBG levels among others. This may be due to the destruction and pancreatic beta cells that affects the insulin secretion. Following the pattern of CA administration, the FBG gradually depleted as higher dosage was administered. This outcome may result from the contents of the extract that could be assumed to be having anti-hyperglycemic properties. The glibenclamide treated group was approached near normal, and according to previous studies, the mechanism involved inhibits the ATP-sensitive potassium channels, hence the decreased FBG levels. OGTT analysis is vital in assessing the glucose level and energy homeostasis. They presented a peak and drop graph, which indicates the glucose lowering effect. Highest peak was actually reported at the 60th minute in the diabetic group. This confirmed that the group's ability to regulate the glucose uptake to be more unyielding. Following the treatment of CA, actually the higher dose seemed to be performing better regulating the glucose uptake than the lower dose and glibenclamide itself. But both show to be closer to the near normal compared to the diabetic group. This indicates that CA compounds have influenced the hypoglycemic effect. Overall, the biphasic curves noticed from the graph proves that there was an enhancement of insulin secretion by respected groups. The IPTT was included in assessing the basal insulin insensitivity. Towards the end of the test, the diabetic group seemed to be showing increment, which indicates the insulin secreted was insufficient for further glucose regulation. The CA extract performed a gradual decrement of the FBG level, which could indicate the ability to stimulate the insulin release and regeneration of the beta cells. Overall, the FBG remained at hyperglycemic range due to certain factors. Diabetic condition gives effect towards the weight and diet behavior, such as polyphagia and polydipsia. The occurrence of weight loss may be due to the glycogenolysis and lipolysis during the interruption of insulin secretion. Not to mention the breakdowns of tissue proteins, which is common in DM. CA extract was studied to have the ability to lower down the food intake due to the enhancement of leptin hormones. The reverse in weight loss effect also seen in CA-treated groups, which could due to its protective effects in controlling muscle wasting. Next, the analysis of the HSI, which is the most imperative indicator of growth. Signs of liver damage include the weight gain by the liver, which due to the nutrients accumulation, most common in the cases of DM, hence higher level of HSI. Interesting, CA has been said to have flavonoids compound that can reduce the fat accumulation, whereas the glibenclamide contains sulfonylurea agents which help in depleting the hepatic glucose production and FBG, thus neutralizing the HSI values. Another indication of hepatocellular damage is assessed by the serum biochemical parameters. Signs of elevation in either of these parameters may be due to the most common issue, the fatty liver development. Because of its hepatoprotective effects, CA administration could be able to improve the elevated levels as well as the glibenclamide. In regards to the lipid peroxidation and antioxidant effects, as mentioned before, diabetic condition induced the oxidative stress in the liver, hence increased MDA and decreased level of antioxidant activities in the organs. Administration of CA proved to be ameliorating this complication by inhibiting the lipid peroxidation formation and preventing further damage to the membrane lipids. The outcome supported that CA extract having the anti-oxidative properties, thus depletion of GPX, the TSOD, and CAT levels. Bottom line, the whole project comes to a conclusion where Centella asiatica aqueous extract possesses anti-diabetic and antioxidant properties and ameliorates the functionality of diabetic-induced liver injury. Thank you.